The World Health Organization is turning to the Greek alphabet to name COVID-19 variants. It wants to avoid stigmatizing nations where the strains were first detected and to help public discussion. First, here's the scientific names of the 4 variants of concern. For example, the one first identified in Britain is B.1.1.7, while the strain detected in India is B.1.6.1.7.2. Under the new system, the variants take on letters of the Greek alphabet in the order they were first detected. So the first letter, alpha, goes to the variant first identified in the UK, followed by beta for South Africa, gamma, Brazil, and delta, India. The new naming system follows months of discussion. At one point, the WHO had considered using the names of Greek gods, but the idea was eventually dropped because many are already the names of brands and companies. Some scientists used bird names, but this also ruffled feathers. Let's take a closer look at the issue with Professor Wang Linfa, who specializes in infectious diseases at Duke-NUS. Professor, this new naming system for variants, the right step forward for you?
I think so, because the naming of virus, it's always controversial. And so I myself, personally experienced that. We discovered virus, 10 years ago, and we have to come up with a name that neutral. Basically, you cannot tell the locality of the virus. So I think that I think it's in the right direction. What I was surprised is that it did not happen earlier.
Professor, how far do you think that this new system is going to go, though, in avoiding stigma against countries where the strains were first, sort of detected?
This actually, the WHO has already a guidelines for naming viruses, and it's made it very clear. We virologists are not allowed, basically, to name a virus after location, after the patient, or after the scientist, or even after, disease symptoms, because that sometimes you think that that's the symptom, but later you found that it's not, right? So it's already been proposed many years ago is to use kind of a very neutral system like COVID-19, for example, was the name of the disease, And so I think it's a practice that WHO really tried to do, but I think, again, for some reason that it did not use that in the first instance. And now I guess it's going to cause a little issue for people like me. We're so used to call the variants by its own name, but I think, it's time to change.
So you're certainly on board with this idea, it would seem, and it does simplify the discussion for you, as the WHO claims?
Once we get used to it, yes, because even the naming of the coronavirus, so here for your, audience, non-scientific, listeners, virus namings coming at a many different levels. So we're talking of variants, right? So variants are different forms of the same virus, the SARS-CoV-2, and the SARS-CoV-2 and then the SARS-CoV-1 is a species, and above species we have genus. So even the genus name of coronavirus has changed. When I start with SARS, SARS-1 17 years ago, we call them group 1, 2, 3. But now the genus even is named as a genus, coronavirus, alpha coronavirus, beta coronavirus, delta, gamma coronavirus. So the Greek naming has already been used at a higher level for coronavirus. And so to that regard, I personally thought it's even simpler. Let's just name one, 1, 2, 3, 4, use numeric, right? Variant 1, variant 2, So, but I guess, to name a variant, use either alphabetic or numerical number, most likely will be the future of most virus naming.
Professor, it's arguably taken the WHO some time to come up with this naming system. People have already been using, as you say, other terms, ourselves included. Do you think it's going to take some time for people to actually embrace this system? Will they?
Yes, I think the system, the time of transition may not be, easy. So that, as I said, the coronavirus naming in the last 20 years, we have already had a change. So I would foresee that, some people may start to use it tomorrow. Other people will use the old name. So the two systems may coexist for a few months or 4 years, but eventually, WHO is the authority, and just like COVID-19 was in COVID 2019, right? So we used that for a few months, and after COVID-19 was announced, everybody just switched. So variant is relatively new, especially the B1617.2 was just named as a variant of concern just a few weeks ago. So personally, I think it's going to be painful for people like me to change, but I think that it's going to happen.
Professor, thank you very much for your time this evening. Professor Wang Linfa, who specializes in infectious diseases at the Duke-NUS.